mixing it. The sugar doesn't seem to dissolve in the water. Even after mixing for a good amount of time, the sugar doesn't seem to dissolve in the water, because the sugar is too much in concentration for the given amount of water. This is one of the important reasons for the formation of gallstones in our body too. Hello, I am Dr. Sreelekha, and today let me discuss in detail about gallstones, symptoms of gallbladder stones and gallbladder stones treatment. Firstly, let me tell you how these gallstones are formed in the body. There is a small bag-like structure called gallbladder below the liver in the right upper part of the abdomen. The main function of the gallbladder is to store bile. There are certain chemical substances which are dissolved in the bile, like cholesterol and bile pigments. If these substances become supersaturated or they are present in too much concentration, like the sugar in the water, they tend to form microcrystals, and over a period of time, these microcrystals combine to form gallstones. Basically, there are three types of gallstones in the body. First are the most common type, that is the cholesterol gallstones. If the cholesterol becomes too much or supersaturated, it leads to cholesterol gallstones. These are greenish yellow in color. The second type are the pigment gallstones. If there is too much of bile pigment, or if the bile pigment is supersaturated, then it leads to pigment gallstones. These are usually brownish black in color. They are seen in conditions like hemolytic anemias. And the third type are the mixed gallstones. Now coming to the gallstone symptoms. One of the most important symptoms is biliary colic or gallbladder pain. The pain typically occurs in the right upper part of the abdomen or in the upper center of the abdomen. It usually occurs after consumption of a fatty meal or oily food. It starts to increase over a period of 15 to 20 minutes and then decreases slowly. The whole episode lasts usually for a period of 1 hour to 1.5 hours. Please remember, gallbladder pain is usually not relieved by consuming gas medications or passing flatus or stools or changing positions. There can be associated symptoms like nausea and vomiting. Other gallstone symptoms include dyspepsia or indigestion, bloating sensation, belchings. More than 50% of patients have gallstones and still they do not have any symptoms at all. So how are these gallstones diagnosed? Most common investigation in any patient who is showing symptoms of gallbladder stones is ultrasound abdomen. There can be blood tests advised to check for any infection in the gallbladder. To get more details of the condition, additional investigations like MRI or CT scan can be advised. Coming to the gallbladder stones treatment. Most often people come up with a doubt asking if gallstones can be dissolved or pass out like kidney stones. Unfortunately, no. Gallstones cannot be dissolved, and it's in fact dangerous if the stone comes out of the gallbladder, because it can lead to complications like pancreatitis. Further formation of stones is prevented by giving medications which include bile acids like ursodiol. Gallbladder stone removal is done by open surgery or laparoscopic cholecystectomy surgery. Not just the stone, the whole gallbladder is removed along with the stone. And your doctor will decide whether you need an open procedure or a laparoscopic procedure. Some simple tips to prevent gallstones formation. Try to avoid oily food, fatty food. Consume more fiber-rich foods. Don't go for crash dieting or sudden rapid weight loss, because this will increase the risk of formation of gallstones. Talk to a dietitian and get a healthy weight loss plan. If you are a female and if you are planning to start oral contraceptive pills, talk to a doctor. Do not take OC pills without supervision. Let's say you are someone who got to know that you have gallstones and you never had any symptoms before, not even a single episode of pain. Most likely you do not need surgery. But there are certain conditions where surgery is recommended. if the patient is having a history of hemolytic anemia, or if it is a post-CABG patient, or if the gallstone size is more than 3 centimeters, which will increase the risk of gallbladder cancer. The best person to decide is a doctor. So if you are diagnosed with gallstones, try to talk to a doctor to understand whether you need a surgery or not. I hope this video helped you in understanding about gallstones and gallstones treatment. Stay tuned to MFine for more such health related videos. Take care.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.